Dr. Evans, thanks for taking my call regarding Mrs. Albright, 72, who I referred to you last week. Her abdominal pain has persisted.
Yes, Mrs. Albright. We initially suspected diverticulitis, given her history and the left lower quadrant tenderness. Her CT scan was somewhat equivocal, showing some wall thickening but no clear abscess.
Precisely. The concern is, while the pain did improve marginally with antibiotics, it hasn't resolved. She's now reporting intermittent nausea, and her appetite remains poor. What's more, she's lost nearly 3 kilograms since I saw her last month, which is concerning. The inflammatory markers are still mildly elevated.
Yes, Mihira, that weight loss is indeed a red flag. When I examined her, the tenderness was less localized, more diffuse in the lower abdomen. We considered irritable bowel syndrome, but her symptoms are far too acute and persistent for that. Given the inconclusive CT and her ongoing systemic symptoms, particularly the weight loss, I'm now leaning towards a diagnostic laparoscopy. I think we need a definitive look.
I concur. My worry was always that we might be missing something more insidious.
Exactly. While diverticular disease is common, her presentation isn't entirely typical for uncomplicated diverticulitis, especially with the weight loss and persistent constitutional symptoms. It's about ruling out anything more serious definitively. It sounds like we need to find some simple ways to make managing your medication feel less overwhelming, Mihira. Consistency is so important for feeling better, and a few small changes can make a big difference in keeping track of everything. To simplify your medication schedule, let's try to link your doses to things you already do every single day. For instance, if you take a morning pill, put it right next to your coffee maker or your toothbrush. If you have an evening dose, tie it to brushing your teeth before bed. This turns taking your medication into an automatic habit instead of a chore you have to remember separately. For any medications that need to be taken at specific times, setting a reliable alarm on your phone is highly effective. You can even label the alarm with the name of the medicine, like morning antibiotic, so there's no confusion. Mihira, when it comes to organizing the actual medications, a weekly pill organizer is a fantastic tool. You can sit down once a week, maybe every Sunday, and sort all the pills into the correct days and times. This allows you to check at a glance if you've taken your dose for the day. If you have a trusted family member or friend, don't hesitate to ask for their support. They could help you set up the pill box each week or give you a quick, gentle reminder if you seem distracted. This journey is much easier with a little help, and these strategies will help you stay on track with your treatment.